Hey folks, Dr. Dan here from DocTalk. Thanks for joining us today. Our guest will be Dr. Mike Sanderson, who's a professor of epidemiology and beef cattle production. We're going to talk about a disease that continues to surface to the top as being issues in beef and dairy herds and potentially at the food chain, Johne's. Johne's disease in beef cattle. Thanks for joining us. More after the break.
Closed captioning brought to you by Kansas Soybean Commission. The Soybean Checkoff, Progress, powered by Kansas farmers. This segment brought to you by Kansas Regenerative Medicine. Your stem cells, your health, your life.
Mike, welcome to the show.
Thanks for having me.
Folks, this is Dr. Mike Sanderson, who's a professor here in the Department of Diagnostic Medicine and Pathobiology at Kansas State University, where he is a professor of epidemiology and beef cattle production medicine. And Mike, we're here to talk about Johne's, and you've done some research on Johne's in the past, or at least done some survey work with Johne's, and you've seen some herds with Johne's as well as a practitioner. Let's just get into it. What is Johne's and kind of talk us through what it does.
Yeah, I think it is an important disease, Dan, and it's caused by a bacterium with a long name. It's Mycobacterium avium paratuberculosis, but for short we call it MAP. And that causes Johne's disease. And in cattle it causes a chronic diarrhea in adult animals that the animals appear to be still healthy, except that they lose weight, they have very fluid diarrhea, and eventually then go downhill until they die or they're culled out of the herd. One of the interesting things about it is, though, that the calves are who is at risk and who gets infected. Almost always they're infected when they're less than a year of age, but they don't show any signs until they're 3 to 4 years of age.
Cool. So this is something that is a chronic illness. It's not something that's a real acute, but it's not going to show up clinically until generally after they've had their first calf. The heifers have had their first calf, or when they reach that 3 to 4 years of age.
Right, that's true.
So with the long name and that, what are of MAP? Thanks for shortening that up for us. But let's talk a little bit about just kind of is it a highly infectious agent? Is it when do calves become infected with it?
So the younger the calf, the higher the risk.
Okay.
So when they're very first born is when the risk is the highest, and it is fairly infectious. So at that early stage of life, they're highly at risk, and that's also right around calving. We've got, in dairy herds, the calving area is very important, and the calf can get inoculated right then if we're not careful. In beef herds, clean udders and that sort of thing are very important to prevent transmission. So yeah, it's fairly easily transmitted, and especially when they're quite young in life.
Okay, and then the disease in mature animals when they get it is extremely debilitating.
Absolutely, they will just really go downhill and get very, very thin, eventually die if you don't cull them.
And so we'll start to see the diarrhea in those animals, in those more mature animals, followed by extreme weight loss because they just don't digest the nutrients.
Right, their gut just gets completely, it gets very thickened, and it just doesn't digest anything very well anymore, so everything pretty much just runs straight through, comes out the back like a garden hose.
Yeah, and actually they have that sewer pipe gut, and they can't digest. We're going to take a break. When we come back, we're going to jump into some of the herd level problems, or some of the herd level issues that we see with Johne's disease and what it can do reproductively, what it can do production-wise. This is Dr. Mike Sanderson. I'm Dr. Dan Thomson. Thanks for watching DocTalk from Kansas State University. More right after the break.
Heinen Brothers Ag Service understands the risk and rewards of farming. As fourth-generation farmers themselves, they understand the importance of using the correct products on every acre. Farmers helping farmers. Heinen Brothers Ag offers quality aerial and ground application, fertilizer, ag chemicals, and anhydrous ammonia. Call today at 800-760-4964 or find us online at HeinenBrothersAg.com.
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net.
Watch Ag AM in Kansas online at agaminkansas.com. DocTalk, brought to you by Santa Fe Trail Meats in Overbrook, or visit us online at sftmeats.com.
Folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Mike Sanderson, who is a professor of epidemiology and beef production in the Department of Diagnostic Medicine and Pathobiology at Kansas State University's College of Veterinary Medicine, where Dr. Sanderson does research, he does outreach, he does teaching, many different hats that he wears. Tickled to death to have you here. Talk about Johne's and kind of on a herd level what we're looking at.
Johne's definitely is a herd level disease. There isn't any treatment or cure for individual animals, and so it's much best managed at the herd level. So if we want to we want to control the risk that we'd introduce it to the herd, and then if it is in the herd, we want to control and eventually eradicate it. One of the first things maybe to think about is how common is it? And so if we look at surveys that are done in beef herds, it looks like about 8% or 8 out of 100 beef herds probably have Johne's in the herd. If you go to dairies, it's probably close to 2 out of 3.
Wow.
About 68% is the estimate for dairy herds. So it's fairly common in dairies, not so common in beef, but in both cases it can be fairly debilitating. For dairy herds that have a high level of Johne's in the herd, may cost something on the order of $200 a cow per year in lost milk, in decreased reproductive rates, and those sort of things. In beef herds, it's probably lower, but it still does cause some economic impact in terms of decreased milk production and then decreased weaning weights and those sort of things.
Sure, it's got to have an impact on the calf crop when the cow's not able to digest the nutrients the way that she's supposed to, and then partition the energy towards lactation. When we start to look at some of these in beef and dairy and the herd level, is there a difference then in the way that we approach these? I mean, I'm going to make the assumption that the dairy industry is more attuned to testing and looking for this disease than what we are in the beef industry.
They are, and probably appropriately so, since they have more. In either case, I think it's a disease that you really want to talk to your veterinarian and make a detailed plan about how you're going to deal with it. Because you can waste a lot of money doing things that don't really work all that well. So any testing plan and eradication plan needs to be very well thought out, or it'll just spend money and not achieve your goals. And
there is a national Johne's program, correct?
There's a national voluntary Johne's eradication program, yes.
Voluntary?
Yes, it's voluntary in that you don't have to be involved. There is no federal support in terms of money for it. There was for a while, and then tight budget times brought that to an end. So there's no federal support, but there is some guidance in what's a good way to approach eradicating it.
Okay. Well, we'll get into that after a bit. But when we come back, we're going to talk more about prevention of how we prevent it from coming into the herd, and then we'll talk in the last segment about how to eradicate it.
Great.
Folks, thanks for watching DocTalk. More with Dr. Mike Sanderson from Kansas State University right here after these messages. Thanks for watching DocTalk. See you in a minute.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Jonathan Angel wanted to be a veterinarian since boyhood. He grew up near his grandparents' farm, where he spent much of his time. Completed the Boy Scout Veterinary Medicine Merit Badge in high school and later shadowed the doctors at Sugar Creek Vet Clinic. After graduation, Jonathan will be joining this practice, and he and his wife will also move back to his grandparents' farm to raise polled Herefords.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
The Kansas Wheat Innovation Center in Manhattan is rediscovering ways to get improved varieties and new genetics in the hands of farmers faster. Grower-led and checkoff-funded research initiatives are bringing about positive change. This grassroots leadership provides a strong voice in Topeka and Washington, D.C. Now is the time to partner with Kansas Wheat in moving wheat forward. Kansas Wheat Commission and Kansas Association of Wheat Growers. Farmers investing in their future and yours. Log on to rediscoverwheat.org.
I'm Dr. Frank Lyons, a physician here at Kansas Regenerative Medicine Center. As one of the only standalone stem cell centers in the U.S., we use your stem cells as therapy for arthritis and some autoimmune diseases.
I'm Dr. Andrew Poe. Here at Kansas Regenerative Medicine Center, utilizing the latest technology under strict protocols, we're able to harvest your stem cells from your own fat to treat a variety of medical conditions. The best part about it is, it's a same-day surgical procedure and requires no general anesthesia.
Soil is the life of a farm, and for 25 years, SureCrop Liquid Crop Nutrition has helped growers produce abundant quality crops while preserving and improving the soils they steward. SureCrop offers complete soil and plant analysis with cropping recommendations, delivery direct to your on-farm storage, and quality crop nutrition custom blended for your field. Choose SureCrop for the assurance of excellence for your soil. Call today or visit their website for more information.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Join Kansas Wheat, King Arthur Flour, and Red Star Yeast for the 2015 National Festival of Bread, Saturday, June 13th at the Hilton Garden in Manhattan. You won't want to miss it.
DocTalk, brought to you by the Kansas Soybean Commission. The Soybean Checkoff, progress powered by Kansas farmers.
Folks, welcome back to DocTalk. Dr. Dan Thomson and Dr. Mike Sanderson from Kansas State University's College of Veterinary Medicine, where Dr. Sanderson is a professor of epidemiology and beef production. And we're talking about Johne's disease, and we're going to jump into prevention because that's really the key for any disease or any injury is let's prevent them from happening. So what is the key to preventing Johne's from entering my herd?
I think the most important thing, Dan, if you can, this is actually difficult, but is to import from herds that are negative. Of course, you have to have some basis for why you think that herd's negative, and probably the best is that the herd you're importing from is involved in that voluntary eradication program. So if they are, then they have tested their herd, and you have some assurance that there's not Johne's in that herd. That is by far the most effective way to keep from importing it into your herd. So seed stock producers, you'd like them to have tested their herds. Dairy replacement heifers, if at all possible, you'd like those to have originated from a test negative herd. Absolutely. So I think it could increase value for people that are looking for value adds in their bull sales or value adds in their replacement heifer sales is getting that eradication or that Johne's free status on your herd, or at least the test status on your herd. Yes. And with a lot of other diseases, we talk about if you buy an animal, to quarantine and test it or quarantine, it doesn't necessarily work for Johne's. Now, because of some things about Johne's disease and how the disease acts, the test is not very good at identifying individuals that are infected. It's pretty good at the herd level, identifying herds, but not individuals. So testing animals as you bring them into the herd and even quarantining them is not very effective. at preventing it from being in the herd. And quarantine because they may not break with the disease in a way that you could see for 2 or 3 years.
Because it's an intermittent shedding, intermittent disease.
Right, and then they're only clinical when they're 3, 4 years old.
Yeah, and so I think it's just as important to know things that don't work as it is to know the things that do, because you can go through a lot of time, money, and effort in quarantining for yonis, and it's not going to make any difference.
No, it won't help.
The other biosecurity tool that people talk about a lot is vaccination.
Right.
And so you said there is a vaccine?
There is a vaccine for yonis, but because it's a similar bug to the bug that causes TB in cattle, this is not a risk for humans in terms of tuberculosis, but it's similar, and so the vaccine will interfere with TB testing. So you have to have permission from your state animal health officer to be able to do the Johne's vaccine. It's probably helpful, at least in some cases, in really high herds that have a very high number of positive cows. But generally we don't use it much.
So it'd be more of a tool that we would utilize in eradication than probably what we would use in like vaccinating cows on arrival. It's not something we can just go buy off the shelf.
No, and only in severely affected herds would you consider using it.
Cool. Well, let's take a break. When we come back from the break, we'll talk about eradicating it once we get it in the herd. And we'll talk about test and removal and different things that we can do to eradicate Johne's. You're watching DocTalk. Thanks for joining us. More after these messages with Dr. Mike Sanderson from Kansas State University's College of Veterinary Medicine.
The BQA Tip of the Day, sponsored by Boehringer Ingelheim Vetmedica, Inc.
Hello folks, this is Dr. Nels Lindberg with Animal Medical Center and Production Animal Consultation out of Great Bend, Kansas. Today's BQA Tip of the Day, we're going to talk about bunk space management as well as pen densities. In this sort of scenario, one size doesn't fit all, and we must always remember that. One of the most critical time frames of pen density and bunk space management is when we're starting high-risk cattle. We want to give those cattle as much room as we can. The general rule of thumb I use is if we're starting high-risk cattle, every animal must be able to come to the bunk at the same time. If you're looking at those cattle and feed them in the morning and not every single high-risk animal can come to the bunk at the same time, we need more bunk space. May not necessarily do anything positive for the economics initially, but on the back end in terms of economics, it will pay on the front end to give them 18 inches of bunk space. We want to give them that bunk space to reduce stress, let them get good feed intake, also give them a good amount of space in the pen. That's our tip for today. Thank you.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
This hog is head over hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
Kansas Farm Bureau, the voice of agriculture, represents grassroots agriculture. The state's largest and most powerful farm organization stands up for its members through leadership development, agriculture education, legal defense, environmental advocacy, farm safety, and risk management. Members also enjoy money-saving benefits. To join our organization today or to learn more, go to www.kfb.org or find us on Facebook and Twitter.
Buying a car shouldn't be this hard. And at Brown Chevrolet Buick in Wamego, it isn't. It's actually awesome. Whether you want a new or used car or truck, Toby's team can make the deal. Even if you want to custom order a new car or truck, Toby's team can make the deal.
See Toby's team at Brown Chevrolet Buick in Wamego. We're awesome.
Here's another gardening tip with Annette Jackson from Jackson's Greenhouse.
Fresh herbs are healthy and add zest to almost every recipe. The folks at Jackson's grow more than 50 varieties of herbs right here, and many are available year-round. Our staff has hands-on experience and can't wait to assist you with your herb needs. Stop in and see us at Jackson's. We're open 7 days a week.
The biggest, largest selection of homegrown herbs is at Jackson's Greenhouse with 4-inch pots starting at just $3.79.
Jackson's Greenhouse has what you need today.
Join Kansas Wheat, King Arthur Flour, and Red Star Yeast for the 2015 National Festival of Bread, Saturday, June 13th at the Hilton Garden in Manhattan. You won't want to miss it.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Kansas Farm Bureau, the voice of agriculture. To join today or for more information, go to kfb.org or find us on Facebook and Twitter.
Folks, welcome back to DocTalk. Dr. Dan Thomson and Dr. Mike Sanderson, and we are from Kansas State University's College of Veterinary Medicine. Dr. Sanderson is a professor here of epidemiology and beef production and has a lot of experience as a beef practitioner, a lot of work in the dairy and beef industries as an epidemiologist and diagnostician and beef production medicine expert, and we're talking about Johne's today. And so what happens once I get it in the herd?
Well, once you get it in the herd, it's actually a long-term plan to try and get rid of it. It's not easy, but it can be done. And the most important things are to prevent transmission to those young calves. So if you're in a dairy, you want to remove calves from the cow as soon as you can after they calve. You don't want to allow suckling or any more contact in that calving environment than you have to for those calves. Get them away and then keep them segregated from the adult cow herd, and that includes any feces from the adult cow herd. We want to make sure that we don't get some feces that contaminates feed. We don't want to feed colostrum that is not from negative cows. So we'd like to test cows, cull positives, and then keep those calves separate.
And I think that the one thing that people need to understand too is that it is a fecal-oral transmission. This is a bug that's in the feces, so if it's, keeping the environment clean, especially in your beef cow herd, keeping the cows and calves in drier areas if possible. I mean, it's common sense for all etiologies of diarrhea, but when you're really focused on Johne's, you got to keep those udders clean. And
absolutely. So that for the beef herd, obviously we can't remove calves from cows, but we do want a very clean environment for calving. Clean udders are really important, and as soon as you can, getting those cows and calves dispersed so that they're not in an environment where the calves have much contact with manure. That's really important and will not only be valuable for Johne's and decreasing transmission, but also in every other enteric disease, calf diarrhea. That's just great for calf diarrhea. So you get paid multiple ways.
Yep, I think people don't understand either that you can track it on your boots.
Absolutely.
You can have, if you go move manure with the loader bucket and then go grab a bale of hay with the fork, or and just the cross-contamination, understanding keeping feces away from the baby calves
really
as much as you can.
And this bug and most of the other diarrhea bugs of calves can live for a long time in the environment. This MAP bug, 9 to 18 months, depending on what sort of where it is. So you have to maintain that for a long time.
Work with your veterinarian?
Absolutely. So that's going to be the greatest source of some technical information that you need to make sure you get it done right.
Cool. Well, thanks for joining us today on the show.
Thanks. Enjoyed it.
Folks, that's Dr. Mike Sanderson from Kansas State University's College of Veterinary Medicine. If you want to know more about what Dr. Sanderson and I do here at Kansas State University, you can find us on the web at www.vet.ksu.edu. Thanks for joining us today on DocTalk. We appreciate you tuning in and learning more about Johne's disease, how to prevent it, how to eradicate it once it does get on your farm. I'm Dr. Dan Thomson. Thanks for watching DocTalk, and I'll see you down the road.
Closed captioning brought to you by Kansas Soybean Commission. The Soybean Checkoff Progress, powered by Kansas farmers.